Hello, everyone. Welcome to Grand Line's online salon. I'm Rama. I'm a communications coach from Grand Line Philippines. I'm excited to introduce to you my partner, Miss Florence Rivera. If you love to travel, she owns Travel Bag Philippines, a tour company. Miss Flo juggles multiple roles. She's also an HR, training and business consultant, and the general manager of Grand Line Philippines. Hi, Miss Flo.
Hello, Miss Roma. Hello, everyone. I'm excited for another episode of today's online salon. Our topic for today is childbirth in the time of pandemic. Is COVID-19 a threat to pregnant mothers?
In this program, we feature several social issues that will allow the speakers to share their expertise and insights regarding the topic. We will be asking them questions about the main topic, and at least two speakers will be given time to state their points. Let's begin.
If you're pregnant, you will be concerned about you and your baby's health during this time of pandemic. COVID-19 can easily be spread from one person to another. Data on the virus are still very limited, and experts are still trying to figure out a lot of things, especially when it comes to pregnancy and birth.
I can't begin to imagine the situation that expectant mothers and couples are in right now. What should be a time of happiness have become a time of worry and anxiety. COVID 19 has unavoidable effects on the mental health of parents and new mothers who are dealing with the stress of business shutdowns, job losses, and school closures, as well as the arrival of a new baby.
That is so true, Ms. Roma. Soon to be parents are used to preparing congratulatory parties or gender reveal before and after giving birth. Now it looks a lot different from what we are used to. For most people, there won't be large gatherings of family and friends for sure.
Right now, it seems keeping the mother and baby safe is the best way to celebrate Miss Flaw. The Department of Health has assured expectant mothers that hospitals are following strict infection prevention and control measures to prevent any spread of COVID 19 in their facilities.
Good to know, Ms. Roma. They say that a woman's body undergoes a lot of physiological changes during pregnancy, which predisposes pregnant women to viral infections and may be considered high risk compared with the general population. I'm not sure if there's truth to this, but this definitely creates a lot of fear and confusion among mothers and parents, which makes our topic today relevant and timely, Ms. Roma. Let's begin by introducing our panel of experts.
Let's welcome our first guest speaker, Ms. Noelle Pollack. Ms. Noelle Pollack graduated from the University of the Philippines, Diliman, and initially started her career as a legislative writer, corporate trainer, and professional dance artist. It was not until her first child was born that Noelle began her journey as a birth worker. She received her training and certification as a breastfeeding counselor from Breastfeeding Pinais and Arugaan, and then pursued further training as a fertility, birth, and postpartum doula. She took advanced per, she took advanced birth doula skills training under the Doulas of North America Inc. in Bali, Indonesia. She has attended several international conferences on lactation and breastfeeding as well. Noelle has taken certifications in aromatherapy and aromatic medicine under the New York Institute of Aromatherapy. She has completed courses in essential oil chemistry, training as a I'm sorry, as a KG hypnobirthing teacher in Scotland, a program accredited by the United Kingdom's Royal College of Midwifery. Noelle is married to Guy and mother to two adorable boys and one girl, Elliot and Luca, 9 and 6 years old, and Malaya, 4 months old. Noelle loves learning new things and is always on a journey of self development. Again, let's welcome Ms. Noelle Pollack.
Hello, good afternoon. Thank you very much for inviting me to this program.
Thanks, Noel. It's our pleasure to be joined by our next guest speaker, Dr. Stephanie Faye Cagayan. Doc Fay is a professor and the vice chair of pharmacology and toxicology at the University of the Philippines College of Medicine. She's a consultant of obstetrics and gynecology and creator of Sayuntis, Sayaw ng Buntis, a holistic childbirth preparation program with combined belly dance and yoga movements as core movements. She is the producer and host of Usapang P, Puso, Puson, Puerta, Pamilya at Iba pa at DZUP 1602. Just this year, Doc Fay earned her Doctor of Philosophy degree at the UP College of Medicine and received Gandingan Award for Most Development-Oriented Women's Program, Usapang P. Welcome to our program, Dr. Stephanie Fay Cagayan. Hi, Doc.
Hi, good afternoon, Miss Flo and Miss Roma. I'm so honored and excited to be here to be sharing uh, and discussing with all of you for this afternoon session on childbirth and breastfeeding expectation.
It's our honor to have you here, Doc.
Let's welcome our third speaker for today, Dr. Janet Gallio de Ramos. Doc Janet is a practicing pediatrician and a diplomate of the Philippine Pediatric Society. She graduated with a Bachelor of Science in Biology degree from the University of the Philippines, Visayas Iloilo campus, and from the WVSU College of Medicine. She took her postgraduate internship and residency training in pediatrics at Makati Medical Center. Now, she's back in Iloilo with her husband and two boys, holding clinics at Medicus and Medical City Iloilo, and heads the breastfeeding committee of the Philippine Pediatric Society, Western Visayas chapter. Let's all welcome Dr. Janet Gallio de Ramos.
Hi, Doc. Doc, I think you're on mute.
Hello, good afternoon. Yes, I'm excited to be here. Hello. Yes, good afternoon. Thank you for having me. I'm excited to be here.
Thank you, Doc. Okay, so let's begin. There have been reports of newborns who tested positive for the virus in China. One tested just 30 hours after birth, with the other 16 days after. Doctors had not yet determined how the infants were infected. Some mothers are afraid that they might easily pass on the virus to the babies in their wombs, which brings us to our first question. Are pregnant women really more susceptible to COVID-19? So I think we can call on Doc Fay to answer this first.
Hi, yes, Miss Flo and Miss Roma. There are a lot of issues because our pregnant women as well as our senior citizens are asked to stay at home since March. Okay, so let me just give a brief discussion on how pregnancy changes the immune system of a woman. And if I am maybe allowed to share just one bit of a slide so so our viewers can actually have an idea. Here it is. As you can see, I'm not going to speak about scientific terms. I just want you to look at there are so many components or elements in the immune system that are changing during the pregnancy state. We know that as a mother, starts to accommodate the growing fetus inside her womb, her immune system now goes in as a constant flux. No, it used to be thought of that pregnancy actually brings about a depression of the immune system, but in totality, everything changes, but not enough to actually make the mother ill during pregnancy. So there's a certain type of balance. However, there is some truth that certain factors or components of the immune system, such as your T cells, that become depressed, and that it now makes the pregnant woman more immune or more susceptible to certain types of infections during the whole of pregnancy. It has been noted in certain researches and even in certain studies that as a woman progresses from pregnancy, first trimester, The second trimester and the third trimester actually makes the pregnant mother more susceptible to infections, most especially respiratory infections and viral infections. And as we all know, COVID-19 is a viral respiratory infection. So yes, in a way, um, we are more our mothers are now more prone to infection and are more susceptible to COVID-19 because of these immunologic changes.
That's good to know, Doc. Very clear and concise explanation. Doc Janet, would you like to, do you have something to add to that? Or if Doc Janet, I think her internet is unstable. Miss
Ah,
Noel?
yeah.
Yes, hi. Yeah, I'd like to just support what Dr. Faye talked about. She did mention that the immune system goes through changes during this time. And so I'd like to take it from the side of educating moms about how to deal with the situation because they are more susceptible to viruses and other infections. So it's really not just COVID that pregnant women are more susceptible to. It's a whole range of issues and conditions that they're more susceptible to. So this is why when we talk about childbirth education, pregnancy education, and empowering mothers, because it's so easy to be afraid when you hear that, oh, you're more susceptible to COVID. And so moms now are super stressed out. But aside from social distancing, aside from taking the necessary precautions and staying at home and all of that, pregnant women should really also be supported in getting the right nutrition to support their bodies, to support the immune system during this time, getting sufficient rest, stress management, and so on. Just because, as Doc Faye said, this is a riskier period in the life of a mother.
I agree. Nutrition, I think, is important to everyone, not just to
I
pregnant
agree
mothers.
also.
Doc Janet, go ahead.
Yeah, exposing the mother in an immunocompromised state, as what Noel have said, um, not makes the mother susceptible to all kinds of infection, and also makes the baby in a risk in a state of risk also. Concerned as pediatricians is the risk of the baby in times of pandemics like this. So we will discuss later what are these and what we expect to from the outcomes of babies of pregnant mothers who have been exposed to a lot of infections during pregnancy.
Okay, so the answer to our first question is a resounding yes. Pregnant women are indeed more susceptible to COVID-19, which brings us to the second question. So, Doc Faye, back to you. How has COVID-19 changed pregnancy and birth procedures and protocols?
Ah, it's actually a very 2 minutes, 3 minutes will not actually be enough. In fact, I give lectures for around 30, 40 minutes just on the changes that this pandemic has brought about on how we practice prenatal checkups, our traditional protocols on childbirth and even the postpartum care for our patients, and most especially, let us not forget family planning. So we have to look at the whole range of services that we have to deliver for our mother's reproductive health. Okay, so siguro to just give a brief rundown of the more important changes. Number one, the number of face-to-face consults with the healthcare providers have definitely decreased. In a pre-pandemic era, perhaps we usually ask our patients to come in once a month. And once they are nearing term, we ask them to come in every 2 weeks, and then weekly once they are already at term or nearing birth. Okay, but now we have lots of patients. messaging us, no, asking for our opinion. Once they find out that they're pregnant, they have their pregnancy test, they're 5 weeks, 6 weeks. We cannot. We actually tell them to just come in at 12 weeks, or let us say it's already at 3 months, just for the viability of the baby inside for their ultrasound. Okay, so perhaps after we really utilize teleconsulting nowadays, in the whole of the 9 months, I think our patients now, our women now will only be able to see their doctors for at least 4, 5, or 6 times. Okay, most of the consults, most of the follow-ups, most of the checkups done will now be via SMS, via your chat. You have your different online platforms. Okay, what do we tell them? So we ask them, they have if they have means, no, if they have means of monitoring themselves, their weight, the baby's movement, uh, other signs and symptoms referable to the pregnancy, they will just report it to their doctors or to their healthcare workers, their midwives, or even their doulas, but not on a face-to-face basis. Then we ask them to come in again at 5 months, at 7 months, um, and then nearing birth. Okay, so that
Eh,
is one. The next one is once our patients are at term around 37, 38
using
weeks,
Wi-Fi.
we now uh, are requiring, no, the Philippine
Yung
Obstetrics
nawawala.
and Gynecologic Society is actually requiring mothers to have swab tests. Okay, not a rapid test, but swab tests, and hopefully they deliver within the next 2 weeks. Okay, so that's another change that we can now see. The laboratory the laboratory exams that are needed will now be scheduled along with the face to face. So we have to make each checkup, each face to face prenatal checkup count. Okay, so but this is for low risk pregnancies. These are for mothers who we are not expecting to have any problems with. Okay, and then during delivery, no, our main goal is to still have vaginal delivery. COVID-19 is not an excuse to have routine cesarean deliveries. Okay, hopefully we want mothers to have a very shortened labor and stay at the facility or the hospital. So if before you can actually make your hospital stay like if you're comfortable you're like in a hotel, now is not the time, no, to be staying long within a hospital facility. So hopefully you come in the hospital already well into your active labor, and then you deliver, and if everything goes smoothly, we discharge you with instructions to follow up. Again, the postpartum follow up will also change, utilizing teleconsultations. We look at your wounds. We ask you how you are again via teleconsults, just like what we are doing right now. Everything is online. Okay. So what other changes? If you want to have your labs done at home, we now have home service for the laboratory checkup. So we really can see everything is being delivered right at your doorstep. No, but what we have to make sure of is that uh, we are all well, and we will not be uh, let us say we will not catch the infection unnecessarily.
Okay. So, wow, telecommuting is really the future.
Yes, it's not the future, it's already here.
It's already here, you're right.
It's already here.
Okay. Miss Noel, would you like to add to what Doc Faye has mentioned?
So for us, what is really as a doula, and as somebody who teaches childbirth education, what has really made a major mark on us is that we are no longer allowed inside the hospital or the delivery room. Prior to this, doulas could access with the permission of the hospital and the OB the room so that we could provide continuous support for the moms. Also, we used to be able to give breastfeeding support and postpartum support face to face. But of course, now all of that has changed because we're thinking also not just of infection control protocols inside the hospital, but also, you know, doing like anticipatory like precautions outside or within the home. So everything is also online for us. But what is very challenging for moms now is that the having a companion of choice is not something that is possible in all facilities. There may be some facilities such as lying in centers that you know, where mothers can do this, or depending on hospital procedure, because the thing is nobody expected for this to happen. And so our hospitals, our OB units were not also ready to take on this challenge. So, you know, everybody kind of had to learn on their feet, including us, including the moms, everybody. So parang for me, that's really the major shift. And so moms who are pregnant during this time, and I understand because I gave birth just before lockdown. So I was still able to have my companion of choice, but I can imagine just the amount of stress and uncertainty that surrounds giving birth, which is why we try to also educate parents on how to work with their healthcare providers to find like a better setup during this
Mm.
situation.
Okay.
Miss Flo, can I add something to what Noel and my previous statements a while ago?
Yes, Doc Faye,
Because
go ahead.
we're talking about emotional preparation, physical preparation, but I think one major thing that most of our mothers will have to prepare now would be financial stability. I think on top of, even before the pandemic, we already have issues about being economically prepared for a pregnancy, for the arrival of a new baby inside our homes. But this pandemic, it's minimum of around 50,000 pesos that a mother has to add on to her budget for delivery, no? Because we have to shoulder, or our mothers also have to shoulder the protective equipments, no, the personal protective equipments of
Oh, that's right.
almost all the people coming in to take care of her. That's why we would want her to stay in the hospital for the shortest period of time possible. So the longer you stay inside a healthcare facility, the more it will add up to the burden, the economic burden. And of course, we all know that with the economic burden, uh, our emotional levels of stress and anxiety also adds up, along with the changes that a pregnancy and a delivery will now bring about.
That's right. Doc Janet, are you there? Please feel
Yes,
free,
okay.
Doc, to add if
Yes,
you want to add, and
okay.
maybe you can also discuss the breastfeeding guidelines, if there are any.
Yes, okay. Can you hear me? Am I okay?
Yes, Doc.
Okay. So actually, the Philippine Obstetric and Gynecologic Society, of where Mom Faye is a member of, and the Philippine Pediatric Society actually came up with new protocols just for this, especially to adjust to the COVID situation of at present. Okay, so the for the baby, we have changes in the protocol to adjust to precautionary measures for the baby not to get the infection from the mother. So some of these protocols, before we discuss them, that we should know how transmission occurs from the newborn from the mother to the newborn. So the newborn gets infected from the mother when he is exposed to the mother who is coughing, sneezing, or even when the mother is crying. So the newborn gets this to his nasal end or to his conjunctiva. So the changes in the protocol were based to cater to these precautionary measures. So initially, for us in the Philippine Pediatric Society, before the COVID situation, we would really recommend for early skin-to-skin contact of the mother and the baby, for non-separation the baby and the mother. But initially, the Philippine Pediatric Society suggested that we do away with this. However, as we move along with the pandemic, as we know more about the virus, the protocol now changed and evolved. And now we are already given an option to practice the usual ways of taking care of the baby right after delivery, which is to practice skin to skin, to do breastfeeding for as long as precautionary measures are practiced.
Okay. So, unang yakap, Doc, is still recommended?
Unang yakap need not be compromised, okay, for as long as proper droplet and contact precaution is practiced. So, we have what we call here shared decision between the healthcare worker and the mothers, which should be talked, which should be discussed to the parents before delivery. So the risk and benefits of skin to skin, kangaroo mother care, and care and separation, and the consequences of not starting or continuing or suspending breastfeeding, as well as the risk of exposure to of the baby to the mother who may be COVID positive, should be discussed before the delivery, ideally. And it depends on the shared decision of the mother and the healthcare worker to do unang yakap. So it did not be compromised, um, provided that we do proper precautionary measures, like the mother needs to wear masks, to wash hands, and to wipe off surfaces that can be infected by the virus.
I read somewhere, Doc, that the mother also needs to wear a mask while breastfeeding.
Yeah, those are part of the WHO and the UNICEF. Never changed the protocol on skin to skin and breastfeeding. From the very beginning, they they always were firm in their stand that breastfeeding and skin to skin should be continued, providing that the three W's is practiced. So what are these three W's? Wearing of mask, washing of hands, and wiping off surfaces. Because if the mother, let's say, sneezes onto a blanket and you put the blanket on the baby, then the baby can be infected that way through fomites. So, unang yakap need not be compromised.
Right. Okay. Well, thank you so much, Doc Faye, Doc Janet, and Miss
Uh,
Noel.
Miss Flo,
Yes, Doc
regarding
Faye,
the
go ahead.
mask, let me just add that cloth masks, especially for women, for mommies who are who are in labor, are not recommended. So if you're going to the clinic, or if you're going to deliver, you need to wear an N95 mask at the minimum. That's why it will be procured in the hospital probably when you're going. In fact, a lot of hospital facilities are actually asking if mothers are requiring for mothers to wear face shields. No, there are also acrylic barriers. Early part of the pandemic, you will see the engineering or facility infrastructural changes that we had to install, to implement, just so to make sure that we are not infected, the mothers are not infected. So even if you are going into labor, you're actually pushing with a mask on, and that is an N95 mask. No? So that's why it's really very hard nowadays um, to make sure that all of these precautions are being carried out. So one companion also with an N95 mask. Let me just tell you a bit of a story that in some of the government hospitals, mothers will come in, they will deliver without really having a companion to be with them because it's hard. It's really hard. So you can imagine the anxiety of our
Yeah.
mommies right now that you have to deliver without any companion beside you, except for your healthcare workers who look like aliens because they're in all with the
That's right.
hazmat
The
and
PPE.
PPEs, so with the bubble hat, the bubble respirator. So especially for first-time moms who we require to actually deliver in hospital. So the guidelines for deliveries for birthing are not changed, no, during this pandemic. And let me add that along with what Dr. Janet has said, the birth plans. It's very important that the birth plans are not suspended during the pandemic. Uh, in fact, it should be strengthened, and a very close discussion with your birth provider should occur. No, the shared decision that Dr. Janet is saying is very, very important at this point in time. Also, how what would be what how our mommies will care for their babies afterwards, the environment that they will be going back to after giving birth. So those are all things that need to be looked at.
Right. And speaking of PPEs, Doc, I believe in Iloilo, they made the headlines for having colorful PPEs, right, Doc Janet? So I guess that lessens the stress a little bit for our mothers. Thank you very much, Doc Faye, Doc Janet, and Miss Noel. I'll pass you on to Miss Roma now for the second question.
Thank you so much, Miss Flaw. I guess this is not a perfect time to get pregnant. So, breastfeeding is the cornerstone of infant and young child survival, nutrition, and maternal health. The World Health Organization recommends exclusive breastfeeding for the first 6 months of life. However, concerns have been raised about whether mothers with COVID-19 can transmit the virus to their infant or young child through breastfeeding. Now, our second question is, will it be safer for mothers to use formula milk instead of breast milk now because of the threat of virus transmission? Let's start with Dr. Janet. Dr. Janet?
Yeah.
Mm-hmm.
First and foremost, it is established that the virus cannot be transmitted through breast milk. Okay. So studies on breast milk of COVID positive mothers found no virus in their breast milk. What was found contrary to this, what was found in breast milk was an immunoglobulin A antibodies that are with reactivity to the virus. So although the strength and durability of this immunoglobulin A have not yet been fully studied at the present, the likelihood that they will offer protection to COVID is really high. So the recommendation is really it is still best to breastfeed whether they're COVID or not. So there's no danger for as long as I've said proper precautionary measures are practiced.
Wow, okay. So I repeat, it's okay to have breastfeeding even if you are COVID positive.
Oh, if I may add,
Uh-huh. Yes, doc?
yes, okay. I
Mm-hmm.
just delivered. I gave birth March 21, so I have a 4 months old baby. And that time it was really the lockdown, and
Mm-hmm.
COVID was new in the country. So
Mm-hmm.
the protocol then in the hospital was to separate the baby from the mother because during the time when I delivered, I was coughing and I had
Mm-hmm.
my test. I had myself tested for the PCR swab test.
Uh-huh.
But I insisted. I told my pediatrician, even if I have to sign a waiver, I will room in my baby and I will breastfeed because I know that if there's no other way that I can protect my baby at this point, no vaccine, no immunizations of the baby, and there's no way that I can protect him only through my breast milk. So maybe I was thinking ahead of the protocols that time, but I also understand that the protocols were there to just protect because we do not know anything about the virus yet during that time.
Mm-hmm.
Pero if you are in doubt, I think
Mm-hmm.
there's nature will provide a protection to our babies. So it is really still best to breastfeed because most likely, and I really believe that antibodies will be passed on from the mother to the breast milk if the mother is COVID positive.
Okay, understood. Well, congratulations on your baby, Dr. Janet. And yeah, so that's it. It's still safe to do breastfeeding to your baby this pandemic. Okay.
Thank you, thank you.
Yes, thank you so much, Dr. Janet. And let's also have Dr. Stephanie.
The early part of actually the guidelines, no, Janet, our guidelines in folks has not yet been updated, but uh it it needs to be updated. They're not really encouraging breastfeeding at this time. But I think the evidence now, because this is novel, no, the pandemic, the
Yes.
coronavirus is novel.
Oo
The
daw.
evidence is coming in as we are going along. No, as just as Noella said a while ago, we need to think on the fly as we have to innovate. We have to modify our guidelines as we go along. And personally, no, personally, I actually encourage my patients to breastfeed. Now, there are several factors to consider when breastfeeding. First would be the condition of the mother. No, at the time, if she's COVID positive, she has moderate or severe, perhaps it's not also advisable for her to breastfeed. No? So the capacity of the hospital or the facility to separate or
Yes.
put the mother and the baby together should also be considered. That's why it's also very, very important for the pediatrician and the obstetrician to, as well as the doula, of course, Noel, kasi you will be following up with our patients eventually once they are in their homes to really plan in advance the how they will carry out all these activities. Now I am looking at the evidence, and they're saying that breastfeeding is okay as long as you make sure that the mother has the mask, right? And then you wipe the area again for the fomites and do vigorous hand washing before and after breastfeeding. So the evidence is now showing towards the encouragement of breastfeeding, unang yakap, essential interpartum newborn care, because in the early parts, actually, my babies have all been separated immediately from the mom, and I cannot give my comment because we were all rushing to deliver the babies because we're all afraid to get infected with COVID. No, so hopefully now we have better preparation, and the mothers will now have they can be in close contact with their newborn.
I see. And I hope there will be like updated guidelines on
Yes.
breastfeeding. Yes, thank you so much, Doc. Now let's also have Miss Noel.
Yeah, so I just wanted to add because we were talking about how, guidelines have to be updated and so on. And like so far, so what the doulas do, because our role really is to help the mothers get as much good information as they can so that when they go into the situation, they can have a very productive conversation with their doctors. And so we refer now to this memorandum that was issued in July. I think it was sometime in July 13, where they issued like the interim guidelines on the management of COVID-19. And it outlines essentially the situations or under which, and what procedures to follow for certain situations, like let's say the mother has had no contact and is showing no symptoms, or what if the mother is exhibiting symptoms, and so on. And so there's, trying to put it, succinctly, it's like for every challenge you have a set of solutions that you can turn to. So I think like this is a more proactive way of looking at it, instead of being like paralyzed by fear and just saying, okay, let's not have any contact at all. And secondly, the new guideline, well, this particular memorandum also states that the um, milk code is still in full force, so there is still no promotion of formula or teats or bottles within the healthcare facility. So now, you have that memorandum, but now you also have to look at what's going on the ground. Are people really equipped to do this? And if not, what can we do to kind of make sure that we are equipping our healthcare providers and our mothers to be ready for that situation. But I also, like, I agree with both Doc Janet and Doc Faye. Breastfeeding is still something that has to be encouraged. If anything, like when Doc Janet was talking, I was feeling myself get a little bit teary eyed because, like, We both gave birth recently, so like the
Ah.
hormones are still in full force. And so this is really like a challenging time for mothers. But absolutely, like if nothing else, a mother will want to protect her child, and the best way to do that now is to strive to be able to breastfeed successfully. So that's
Exactly. Yes, exactly.
Yeah,
Thank you.
and may I add
Yes.
also,
Yes,
um,
Doc.
yeah, with regards to the facilities, there is a current recommendation from India. We know that maybe the healthcare system and the facilities in India will not be far from what we have here in the Philippines, because ideal is really different from what we see in actuality.
Mm-hmm.
So we can do we can do rooming in and skin to skin contact of babies and mother, provided that we have to ensure a good facility for isolation. We have to make sure that, so it depends of the facility of isolation, the healthcare facilities that we have, and if the baby has a risk of getting virus from the community. So, for example, if there's a high risk of getting the virus from the community and there's no good isolation facility for the baby and the mother, and the facilities for healthcare is not good, then it is better for the baby to be together with the COVID positive mother and receiving the mother's breast milk for possible for antibodies, rather than expose the baby outside in the community without without making sure that the baby is safe there, because that will
Mm-hmm.
put the baby at more risk. On the other hand, if the situation is ideal, that's what they said here in India, that if the situation is an ideal, we have a good isolation facility for the mother who is COVID positive, and for the baby can be taken care of by a relative or somebody who is healthy and who
Mm-hmm.
can practice who can take good care of the baby, and we have good isolation. We can give not formula milk, but mother's own milk or mom. This is milk that is expressed by the mother and given to the baby by a cup or by a spoon, so that the baby still gets the immunoglobulins from the mother, and yet we do not sacrifice exposure if we cannot do um, without it. Or if the mother, let's say, is not stable, if the mother needs to oxygen or there's aerosolization risk of exposure. So the ideal thing is to isolate the baby, but not give formula, and instead give milk that is expressed from the mother through a through a different method.
I see. So in connection to that, Doc, so I my follow-up question here. So some mothers look for volunteers or milk banks for supply. Is it safe to get donor milks nowadays?
Um, Donor milk safety is just the same as with previous practices of donor milk, because the coronavirus is not transmitted through breast milk. So even
Mm-hmm.
if you, there's no reason to, let's say, pasteurize milk for, let's say, coming from the mother, if the fear is to get coronavirus from the breast milk. Okay,
Mm-hmm.
we pasteurize the milk to to make it clean of other infections, of
Mm-hmm.
not of coronavirus, because it is not transmitted to breast milk, so it doesn't change the handling of breast milk with COVID and non during the COVID, now in COVID times and before, does not change, because COVID-19 hasn't been seen in breast milk. So if you ask me if it's dangerous to get from others, it is best
Mm-hmm.
to get mom's own milk and give it to the
Mm-hmm.
baby. But if mother cannot give milk, because let's say the mother is unstable,
Mm-hmm.
is very sick in the hospital, we can get milk from a donor milk and handle it the same way we handled it before this pandemic.
Oh, okay. I see. Thank you so much, Doc. So let's also have Dr. Faye for any additional information about donor milk nowadays.
No more additional information. Dr. Janet is the expert on that. Once my mommies give birth, that's all. Dear Pedia, the mother is the baby is now yours, and most of the instructions for the mothers will be coming in from lactation consultants and doulas like Noel, no, and Janet. But I do encourage my patients to have to do breastfeeding.
Mm.
I'm quite thankful that I have not been I haven't given birth for the last 20 years. I really don't want to be in this scenario right now. I cannot imagine the anxiety level that our mothers and our would-be mothers are going through right now.
Okay, thank you so much, Dr. Faye. And may we also have Miss Noel? What's your opinion about donor milk?
Oh, so when it comes to donor milk, we follow the same guidelines that Doc Janet talked about earlier, pretty much. But I agree that it's the priority really. There's a hierarchy of feeding. So first of all is direct breastfeeding, and then second is mother's own milk because for the benefit of a lot of our audience who might not know yet, actually the mother's milk is specifically like made for that baby. So there's a very real interaction going on. So when the baby latches onto the mother makes the right antibodies that specific baby needs. So that's our priority. And also at the same time, if we use donor's milk too much as a crutch, the tendency is the mother will not receive the stimulation needed to produce more breast milk, especially during this time when her supply has not yet been regulated. So there's really a good chance that her supply will go down if she does not express milk. Let's say her baby is separated from her and she does not express milk, then she will dry up eventually. So we want to avoid that situation. We want to empower the mother to be able to feed her own child. Now, as again, if that's not possible, then donor's milk is fine. If you get donor's milk from a milk bank, anyway, it will be pasteurized. So a lot of mothers' concerns can be put to rest with that. Now, if it's peer-to-peer sharing, now that one is a little bit more complicated. Now, it really depends on making an informed decision as to who the donor is. Um, and having a personal relationship with the donor of the milk that you are giving your child. But again, like all of this is not parang a black and white situation. This is really a situation where you make a risk and benefit assessment, and you try to go to the side that provides the baby the most benefit.
Thank you so much, Miss Noel. Is it a lot more expensive right now to give birth because of this pandemic?
Definitely. At
It's
least
a
an additional 50,000 for most, on
Whoa.
top of the usual amount that we ask our patients to prepare. And even if they're giving birth
Uh-huh.
in government facilities, charity facilities, they still need to shell out funds. I think in a primary birthing center, some lying ins are, when it used to be just around 2 to 3,000, 5,000
Uh-huh.
at most, you will
Mhm.
now have to prepare 11,000, and
Wow.
that is really, my heart bleeds for our patients right now, especially those who do not have
Yeah.
who do not have enough resources.
Mm-hmm. Wow. Okay. So it's not yet the right timing to get pregnant. This pandemic. Well, anyway, thank you. Yes, Doc, would you like to add more?
Yeah, right. But we're going to that next question. We're going to talk about family planning. I hope we do talk about family planning in this session, in our session right now, because that's the next segue, the next issue that we really need to discuss. No? When is the right time to get pregnant? But the scenario is different on the ground right now.
Yes, absolutely. Well, thank you so much to our guests. And yeah, let's continue our discussion with Miss Florence.
All right. So we're learning a lot, Miss Roma.
Yes.
Okay, going to our third question. I think we can insert family planning here, Doc Faye, as you requested. But the main topic is teenage pregnancy, which affects almost 6% of Filipino girls, which is the second highest rate in Southeast Asia, based on the Save the Children's report. An estimated 538 babies are born to Filipino teenage mothers every single day, according to the Philippine Statistics Authority. There are studies that teenage pregnancies increase in times of crisis, such as this pandemic. The problem is early pregnancy forces girls to take on an adult role while their bodies are often not ready. It can also trap girls in an escapable cycle of poverty and create a greater risk in terms of maternal complications that affect both the mother and the child. So, our third question is: are there laws and guidelines in place specifically to help teenage mothers with their pregnancy? Miss Noel, would you like to start?
Okay, like the reality is there is very little support on this end. Even when it comes to our laws, we do have laws that support single parents. So there's that. But for our young children, or our young adults rather, or not quite adults, who are forced to take on an adult role, like there is very little education or support. So I think like that is the next frontier that we will need to tackle, because there is very, very little effective sex education in the country on the ground. So when we talk, and it's not even just with teenagers, when we talk sometimes with adult women, they are very ill advised on what effective contraception is. There are many, many misconceptions about whether withdrawal is an actual contraceptive method or not. And so this causes huge problems for our young people. And then secondly, I think there's a problem also of the stigma. So we don't really have regulations in place that could address the stigma, because then if teenage mothers are stigmatized, it becomes even more difficult for them to get good education, and so they end up doing practices that are not optimal for their health or the health of their child.
That's right. Doc Janet, would you know where teenagers can get support or education and help? For example, in Western Visayas, are there any places where they
Yeah.
can go?
Here in Iloilo, we have existing programs to support teenage mothers, which are implemented in the DOH hospital. So we have one DOH hospital, regional hospital here. So once a teenage mother come in for their first prenatal checkup, they are enrolled in a young parents program, or YPP, or the young parents program. And then this program offers lectures like mother's class, prenatal breastfeeding counseling, and after they have given birth, they are referred back to OB for postpartum contraception. So they are also given privileges like priority during prenatal and priority on admission. When they need emotional support, they are referred to community support groups. But this is ideal, no?
Mm.
Not We do not really know if this is practiced perfectly, especially now when the same DOH hospital who has this program is the same DOH hospital that is the COVID center of the region.
Yeah.
So now they have temporarily suspended this program, and these patients, maybe these mothers, are just get their support from families or from support groups, but not anymore in this hospital. I just asked yesterday what has happened to the outpatient department of the Department of OB of this hospital, and they have suspended consults, and they only resort to online consults now. So, but if there's no COVID, this is an ongoing program of the DOH, only in the government hospital. But with the private, I guess it is individually practiced by our obstetricians also.
Mhm. Thank you, Doc. Doc Faye, is there like a family planning session
No, yeah,
specifically for
no.
teenagers?
We actually have one law. Okay,
Mm.
we have one law that comprehensively tackles all the problems about childbirth, etc. So we have the Responsible Parenthood
Mm.
and Reproductive Health
Reproductive
Act of
health, right?
2012. This is the reproductive health law, no, officially designated as RA 10354, and all the components of how to take care of our mothers, most especially our, the teenage moms are vulnerable. They're not just mothers, they are also children. They are
That's right.
children having children, right? So even before the pandemic began, it is there's already a census that 1 in 10 10 teenagers ages 15 to 19 years of age has already given birth, and this is before the pandemic. Now, what is now the problem that we have right now with the pandemic? Everybody is at home. Okay, uh, we are expecting issues such as violence against women, uh, abuse of children and women to go up, right? Because it used to be that for some children, the schools, no, other places are safe places, right? Safe places. But now they are at home, and then their abusers are also at home. So we're expecting a lot of problems associated with teenage pregnancy in the coming days. Now it has been projected that in 2018 we have I think around already around 1.7 million births. No, this is in 2018. We are now expected to have around 2 million by 2021. Okay, 2 million unintended pregnancies. Oh, 2 million pregnancies by 2021, and around 18,000 of that will be from teenagers. Okay, so just to give our audience the magnitude of the problem that we healthcare workers are faced with. So in the Philippine Obstetrical and Gynecologic Society, we have different programs catering to our teenage pregnant women, no, in different localities, local government units. I'm so happy that Janet has this program in their hospitals. Actually, nationwide, each hospital, each locality, local government unit has already placed uh, provisions to take care of adolescent mothers. No? So you have in Bicol, I know they have the buntis, so teenage buntis, no, or pregnant women. So that it's the same. You have a priority for our teenagers, so the giving and the family planning component after they have given birth is very, very essential. That's why I have been emphasizing since a bit before this discussion that a part and parcel of the services that we need to deliver to our mommies right now would be a very, very good discussion on their family planning needs after giving birth. Okay, for healthcare workers, it has to be that once our mommies come to us, we already prepare 1 year supply na of 1 year supply of contraceptive needs for them. If they have to be inserted with whatever depots or family planning methods, once they go very limited face-to-face consults, right? As I've said a while ago, use this limited face-to-face consults to provide already the family planning needs that they have to. And our adolescents and our teenagers are the most in need of this service.
Yeah. It's great that you mentioned the reproductive health bill, Doc, because I think that did not receive any budget or a very low budget from the government this year. So,
Uh, all the health issues have very low budget from our government. Let me just stop my mouth now because it's afternoon now. But this morning, let me segue a bit just to also make people aware. Just this morning, there's a call by almost so many bodies, so many doctors clamoring for
yes.
time out time out from all this pandemic
ECQ, I heard that.
related.
Yeah.
Yes, and you're clamoring for ECQ. And I think our mommies, no, for our mommies to have good health providers, including doulas, this time out is very much needed.
Yes, I think so too. And our cases are rising. So it's going to be, if it's stressful for mothers the past few weeks, I think it will be more stressful the coming weeks, especially in Metro Manila. Well, thank you for that, Doc. And speaking about that, since most of the hospitals are full, where can mothers go, Doc? I
we have the
mean,
service we have the service delivery network. They are still encouraged to that's why there's triaging for low risk mothers. You're encouraged to give birth. Let me just tell you that home births ever since have not been encouraged by our
Mm.
societies as much as possible. You need to be to deliver in a facility-based. It has to be a facility-based delivery, and you have to be assisted by a skilled birth attendant. Okay, so home births are not encouraged. But again, the reality on the ground is that so many women are afraid to go to healthcare facilities. I
Yeah.
have patients telling me that bahala na or come what may, wherever they will have the labor pains, that's where they will deliver. Okay,
Mm,
so
mm, mm.
but we encourage them to contact their community lying-in centers, no, for those who don't have access to private facilities. But you have non-COVID hospitals, non-COVID facilities. As early as the first time you find out that you are pregnant, please check out where you can give birth safely.
Mm.
The operational word is safely.
Yeah.
It's incumbent on you to take responsibility for that and not just allow the doctors to tell you, because most doctors now also fear for our own lives.
Right.
Very few would really want
It's
to.
really bad.
I myself, no, have stopped really doing clinics for now because I'm more than 50 years old and I have comorbidities.
Mm.
So a lot of doctors are afraid. Okay, so the first time you find out that you are pregnant, look at where you can deliver or find appropriate prenatal care for your pregnancy that you would want.
Right. Okay. Thank you, Doc. Miss Noel, would you like to add other alternatives as a doula? What do you usually tell your clients?
So first of all, like we really encourage our clients to have a very open relationship, a very honest communication line between themselves and their doctors. Um, so I understand there is now more of a push or really kind of like a motivation for women to do home births. But first, there are several considerations for women who are thinking of doing home births because, for one thing, there are some cities where it is prohibited. So that's one thing they have to consider. The next thing they have to consider is finding a midwife who will do it in the first place, and also an OB who will sign off on that. Because planning a home birth is not just like making that decision, it also includes thinking of your transfer plan. If you because you absolutely need to have a transfer plan. If you're going to do a home birth, you need to understand the timing of transfer and so on. And so I think that that's why a lot of our healthcare professionals, a lot of our doctors, although there are some who will sign off on supporting or being a backup for a home birth, a lot of our doctors are really encouraging facility-based births now because we don't know like what the traffic situation is. But again, like that's a dialogue that you need to have, and that has to be like an informed decision that mothers make. So right now, our best bet is really to encourage mothers to take on the lifestyle choices that will lessen the risk for will lessen the probability that they will have a high risk pregnancy. So
Mm.
that's really like all we can do at the moment.
Okay. Thank you, Miss Noel. And Miss Janet, I think the situation in Iloilo is very far from the situation here in Metro
Ah, yeah.
Manila. So, are how are hospitals there now? Are they full also? But I think Mayor Jerry is doing a very good
Good
job.
job. Yeah. Thankfully, we're not yet full. Okay, the hospitals are not yet full, and if and when that happens, each of the hospitals here, it has been, I don't know, we have a designated. Most of the hospitals have a designated floor for just OB patients. So this is the clean area, no infections in that floor. So after the triaging, like Mom Faye said, they are triaged into if we're an infectious case or a non-infectious case. So hopefully, we will not run out of beds for women who want to deliver because we have allotted. Most of our hospitals have allotted rooms
Mm.
specifically for the purpose of non-infectious cases or for birthing.
Okay. Good job, Iloilo. Okay, well, thank you so much, Doc Janet, Doc Faye, and Miss Noel. So let us now move on to the next part of our program. Ms. Roma?
Thank you so much, Miss Flo. So, as we move towards the end of the program, let's have some questions from our curious viewers from YouTube and Facebook. Let's have the first question. This is for, I guess, Dr. Janet. So, the question is it safe to give birth at home now that most hospitals have COVID 19 patients?
Oh, I think I'm not the best person to answer that. Uh, can I pass the question to Ma'am Faye or to
Yes.
Miss
Sure.
Noel?
Sure. Okay.
My answer to that is still a resounding no. Not necessarily in a hospital. You can give birth in a lying in facility, okay, or a birthing facility, but hopefully not at home. If the choice, if your back is pushed against the wall and you really need to have to deliver in a home, please make sure that you have a skilled birth attendant with you. And it's quite important to have good prenatal care, just so you know of your risks, no, whether you're low risk for having complications, because it's so hard to be transferring patients now. And remember, when you deliver, it's not just you, it's also your baby that has to be transferred if any problems or complications arise from home birthing.
Okay, another question here. This one's for Doc Faye. Which delivery is recommended by doctors now? C-section or natural birth?
That normal delivery, vaginal delivery is still the delivery of choice for all pregnant women. We will only do cesarean sections for the usual indications that we do cesarean sections pre-pandemic, like obstetric or fetal indications such as fetal distress, no, bleeding from the mother, placenta previa, or malpositions, meaning the head is not the presenting part of the baby. But in general, we would still want the mother to deliver vaginally or naturally because it has less aerosolization, as they say. The chances of the COVID, the droplets coming out from the mother would be less. So safer also for the doctors.
Okay.
And we still have one last question here. What are the alternative ways of giving birth now? Who would like to answer?
I think this one's for Miss Noel.
Miss Noel.
Yeah.
Um, from that, like it's quite a general question because like right now I don't think anything has really changed when it comes to um, the types of birth that we can possibly have. It's just really kind of the logistics around it that has been very different. So if we're looking at alternative ways of giving birth, so to speak, I think the types of birth that are not so well known yet are water births and so on, although in some facilities there are hospitals that do have water births, but I think even the protocols for water births have changed now in the time of COVID. I was still able because I was still able to have a water birth for my baby 5 months ago because it was prior to the lockdown, but I know that infection control procedures have also had to be adjusted. So there's that. But for those who are looking to have a natural birth, who want to have the least amount of medication possible, they can also go for unmedicated births. They can do hypnobirthing. These are all not really methods of birth, but really kind of tools that we use in birth because you still have either a vaginal or an abdominal birth or a C-section. That's pretty much still the range of choices. It's really just how you cope and how the mother feels best supported during her pregnancy and birthing journey.
Okay, thank you, Miss Noel.
Okay, thank you so much for answering the questions from our YouTube and Facebook viewers. Now let's go to the next part of our program. Let's hear messages from our guests. Let's start with Miss Noel for your final message.
Okay. My message to mothers out there is really do not let the fear and panic overtake you. The Pinay Doulas, we always like to say, you are the author of your birth story and you have the power to write it beautifully. And despite all of the challenges that the current situation has placed on our backs and the backs of our doctors, this is still true. You can still take charge of your situation. First of all, by taking good care of yourself, making sure you get adequate nutrition, rest well, manage stress, because chronic stress does bring the immune system even further down. So we want to be able to cover those areas, take a look at our lifestyle. So it's still really going back to the basics. So I feel like our message has not really changed. It's just become parang more immediate. Still breastfeed, all of this is still very, very important. So this is the time to kind of be in the moment, silence ourselves, and find our peace. Mothers need a lot of peace. Find your support group. Make sure you have a strong support group and get into a very honest and open communication with your doctors. That's it. And have a
Wow.
wonderful pregnancy.
And if
Well,
you need a doula, Noel is the best.
thank you so much, Miss Noel. And let's also have Dr. Stephanie.
I think Noel has already echoed the same sentiments that I hold as well. But in addition to that, let me just add that we continue to follow the WHO guidelines on how we protect ourselves, no? How we protect ourselves and our family and loved ones from the disease. So again, uh, panic is not the best reaction to what is happening right now. Your obstetricians are here, your healthcare workers, your midwives are here to assist you, to provide the best care for you. And we will all, medyo, we really will have to help each other out in order to make your birthing experience, your pregnancy journey, the best that you will have, despite everything that is happening around.
Thank you so much, Dr. Stephanie. And let's also have the message of sorry,
Talk Janet.
Dr. Janet.
Okay, for me, I cannot overemphasize the prevention of SARS-CoV in this time. So hand washing, wearing of masks, and wiping off surfaces or cleaning and disinfecting. But for the general population, social distancing should not be taken for granted. But for mothers and babies, um, the dyad non-separation can be done and can be provided there is proper respiratory droplet precaution. Let us not forget that the mortality rate is 14-fold higher in infants who are not breastfed compared to infants who are exclusively breastfed. So the children appear to have low risk for COVID-19. They either have mild or no symptoms at all. So the risk of not breastfeeding or not taking care personally of your infant outweighs the risk of getting COVID in infants. So I believe that nature will not give our children or our babies at least a fighting chance with this virus. So it will naturally give our babies the defense that they need. So this is through our.
Thank you so much, Dr. Janet. And let's also have the final message of Miss Florence.
Yes, well, thank you so much, Doc Faye, Doc Janet, and Miss Noel. I believe the number one source of fear is usually lack of knowledge, right? If we don't know anything, not much about anything, we usually fear it. But so I hope that today our guests and our experts were able to provide knowledge to our mothers and expectant mothers and parents to help them with their birthing decisions and as well as breastfeeding decisions. So thank you very much for the privilege of your presence, Doc Faye, Doc Janet, and Miss Noel. And this is also our season ender for the online salon, at least in this format. We will be coming back with a different format in the next few weeks. So stay tuned for that, guys.
Yes, thank you so much, Miss Flo, and we're excited to watch the new format of online salon. And that's it. It's a very meaningful discussion today again, and we hope you learn as much as we did from our speakers. Thank you so much to our guests for today and to everyone who joined us, including the technical staff. This will not be possible without each of you. And we're looking forward to seeing you again on our next online salon. And as what Miss Flo said, stay tuned for the new show format coming soon. Thank you so much for watching today, and please don't forget to leave a comment, like and share our videos, and subscribe to our YouTube channel, GLCA TV. And let's also have the thought of the day.
Okay, our last thought of the day, Ms. Roma. Giving birth should be your greatest achievement, not your greatest fear. That's from Jane Wideman. So again, this is Florence.
And this is Roma. For now, stay safe, everyone.